Welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm Dr. Izabella Wentz, and I'm so excited to have you here today. We're going to be joined by Jeanne Reilly, and we're going to be talking about postpartum health. We're going to be talking about how to reclaim your health and energy from thyroid issues caused by postpartum depletion. And I'm going to tell you a little bit about Jeanne. She is a registered dietitian and mother of two with over a decade of training and experience in prenatal and postnatal nutrition, research, practice, and application. She's the co-founder of I Am Nurtured, a holistic prenatal and postnatal supplement company with the mission of supporting parents from preconception through postpartum and beyond with the research-backed ideal amounts and forms of vitamins, minerals, and botanicals they need to thrive through every stage of parenthood. Jeanne combines professional expertise and personal passion to address the often overlooked nutritional and hormonal challenges moms face. Jeanne is committed to helping women feel their best, nurture their health, and thrive in motherhood. Welcome. Thank you so much for being here with us.
Thank you for having me.
So I always like to ask, can you tell me a little bit about your training as a dietitian and what you learned about supporting women during postpartum and prenatally?
Yeah. So I went through a traditional coordinated program in dietetics, which is coursework plus a year-long internship. And I will tell you that we did not learn much about pregnancy or postpartum nutrition support. We learned, probably basics, maybe a page or two in our nutrition textbooks, but it was not an involved, in-depth study. And it was not until I went through the experience myself that I realized how badly it was needed to really dive in and specialize in this area, because there's so much information out there that is needed to prepare moms and to help them through this super demanding time.
I think it takes going through the experience yourself to really realize how much of society isn't really focused on this really precious and important part of a woman's life. I know when I had my son, I remember going weekly to prenatal visits and going to see doctors and nurses and midwives. Like every week we were checking in. And then after he was born, I had my 6-week visit. I show up to the clinic and, I'm leaking breast milk. My hair is all over the place. Like I got childcare, and I show up and I was actually on time for my appointment, but I didn't check in, or something happened to the point where I just didn't have my act together, right? Because I was 6 weeks postpartum with my first baby, not sleeping at night. And the doctor that was supposed to see me just decided to go to like some meeting instead or leave early. And I was just so mad. I was so upset. I was like crying, my milk is leaking everywhere. And I was like, this is awful. Like, I'm having issues. I need to talk to somebody. And I think I read somewhere that society treats women and babies, they think of the baby as the candy and the woman as the wrapper. And they really care when that candy is inside of the wrapper. But once that candy gets removed, the wrapper is just discarded. And I can tell you, I really felt that day.
It does feel that way. And I think, as a culture, we reflect that for new mothers as well. I had this vision of when I was pregnant with my first that, I was just going to welcome this new baby into my life and he was going to fit into my life. And rather than vice versa, rather than me making my life fit a new baby. And, I was working for myself at that time. I didn't tell any of my clients I was pregnant because I didn't want any stigma around taking time off. I didn't have an employer. I didn't have maternity leave. So I was just thinking to myself, I'll take a few days off when I give birth, and then I'll take some calls while baby's napping. Well, my baby did not like napping. He did not like being put down at all. So I had this rude awakening that this, falsehood I had created in my mind of just being able to carry on with my life with a baby in tow was it was just not going to work. And worst of all, I had these expectations of myself because I think of the messaging that we receive from the culture to just lean in and do more and make it happen and go back to work. And not take the rest that we need and deserve as mothers, and really to establish ourselves as this new little family unit. I went back to my sport, rowing, at 5 weeks postpartum, and, just threw myself back into my life without giving myself or my son any time to adjust. And I was applauded for it. Wow. No one encouraged me to slow down. And it all came out in the wash. We hit 6 months and I was like, what am I doing? I am exhausted. I completely burned myself out. And I had problems with milk production from the get-go because I was just so stressed and so overdoing everything. Like, of course my body wasn't producing enough breast milk, So it's just, your body tells you what you need. And I think our problem is that we don't listen.
Absolutely. I was reading a book the other day that brought up a term called matrescence. And that just made so much sense to me, because when we go through a hormonal change as teenagers, this is known as adolescence, and we sort of expect that adolescence is going to be awkward and messy, and kids are going to have acne and have all of these weird feelings and so on and so forth. But it's really a growing phase for these children. It's like they're going from a child to an adult through adolescence, and nobody prepared me about matrescence. No. So this is a time period when our hormones are rapidly changing, our brains are changing, and we're going from, woman to mother, right? This is such an important time in our life.
Yes, it's a transition. It's a change, and you will not be the same after. And I think that's going on, this cultural message we receive of getting back to yourself after baby. Your body will be different forever. Your brain is changed physiologically. Your hormones are different. We all want to reach that place of comfort and health and feeling vibrant after baby. And that's applaudable, but it is having the expectation that everything will just return to the way it was before baby. Like, you can't go backwards in adolescence. You can't go backwards in matrescence either.
Yeah. You don't want to either.
Yes.
Right. I feel like the other side of matrescence, I could say this now, I have a 6-year-old. So I'm like, okay, I'm out of that awkward teenager phase that I felt as an adolescent in my motherhood journey as well. And for every woman, that can be different depending on their first baby might be different than their second baby, than their third baby, right? And where they are in life. Not every woman is going to go through the same matrescence, as not everybody goes through adolescence the same way that they do. One thing I really wanted to focus on today is I feel like as a society, we don't really focus on the needs of postpartum moms. In my line of work as a thyroid expert, I can tell you that many women, they have their babies, and after that, they develop postpartum thyroiditis. Some of them return back to normal thyroid function after that, or some of them just end up with postpartum thyroid issues that remain. We also know postpartum depression, postpartum psychosis. All of these things can actually be related to thyroid health as well. And I feel like there are things we can absolutely do to support a woman postpartum. And nobody's really talking about that. So I'm really grateful to have you here to share more about what's going on postpartum and how do we support women?
Yeah. And I think, we can go further back into where this, the impetus of all of the things that are happening in the postpartum cocktail that leads to thyroiditis and other thyroid issues that may be longer term. But namely, there are lots and lots of new stressors in your life. You may be experiencing all of these different hormonal cascades. There's this huge drop in progesterone and estrogen after giving birth, which causes a stress on the body. There's ample amounts of inflammation all over your body. Inflammation is not great for thyroid, right? You are also in one of the most nutrient depleted states of likely your lifetime. And a lot of these nutrients are supportive of thyroid function. So you think about selenium, you think about iron, so many different nutrients, iodine, Insulin resistance is another one that is so common in the postpartum period, which plays into the stress complex, the inflammatory complex. All of these inflammation and stressors are affecting your thyroid function. So whether you're going and experiencing postpartum thyroiditis, which you mentioned is a shorter term or acute inflammation of the thyroid, or a longer term, it turns into something else longer term because we're not addressing all of these issues that are causing this inflammation. And it really does burn out your thyroid, So really making sure that we can take care of moms and give them the education that they need to stay replete in these nutrients that are supportive of their thyroid health, to really practice different lifestyle practices that are going to bring down their stress levels and feed and nurture their bodies in a way that take care of their thyroid and their health in general.
I love that. So a lot of times people talk about postpartum depression and they say that the root cause is because a woman isn't supported, right? And I feel that could be a really important root cause of that. So if you don't have that support system around you, which, isn't as easy to come by for most people, then you can absolutely feel unsupported and depressed. The other thing people talk about is progesterone deficiency. And we do know that sometimes supplementing with progesterone can be very helpful for postpartum depression. And I know personally the sleep deprivation was really, really tough for me postpartum. But nutrients, nobody really talks about the role of postpartum nutrient depletion and how that can play a role in thyroiditis and postpartum depression and all of the symptoms that we feel postpartum. So what are some of the nutrients that are commonly depleted postpartum, and why do so many women become depleted?
Yeah. And I think, a reason that this isn't part of the larger conversation is because when you go and have a baby with the traditional medical route, you're seeing an OBGYN who has maybe a couple of hours of nutrition training, right? They are not as educated on it and they don't look at it. And I think a lot of women might just be dismissed as, experiencing normal postpartum symptoms and like, it'll be okay, just give it time. You're in a really stressful time. The people who will talk to you about nutrient depletion postpartum are more functional medicine doctors, nutrition experts. So if you feel like you're not being heard by your doctor when you're coming with symptoms that are really bothersome, whether it's stress, whether it's sleeplessness, whether it's, overwhelming feelings of anxiety or insomnia or the postpartum depression or psychosis, if you're not feeling heard, you have to look for answers elsewhere, which requires more energy and effort, which is really hard to come by when you're a new mom. But it is better than just sitting and waiting it out because it may not go away potentially. So things that you can specifically ask for include micronutrient testing, vitamin mineral testing, and looking at a deep dive of your thyroid, which most doctors will not do without asking, and some will not do even when you do ask. So finding the right practitioner. But when we're looking at specific nutrients that truly are in higher demand postpartum, we're looking at iron. Iron anemia is very common during pregnancy and becomes even more so, especially if you do have anemia during pregnancy. It can become exacerbated during postpartum, especially if you have a lot of blood loss during your birth or you have surgery, C-section. So repleting iron is a big deal. And it also plays into the energy that you feel. If your iron is depleted, your blood cells are not getting enough oxygen and you're going to feel this crippling fatigue. Vitamin D is another one that is a huge, huge need during postpartum. Our needs increase. And it also passes to baby through your breast milk. So if you're a mom who's ever had to do the vitamin D drops, here's a little tip. If you get 6,400 IUs of vitamin D during your postpartum, so whether it's from food or in addition supplement, you don't have to give the vitamin D drops. So there's research to support 6,400 IUs of vitamin D consumed by the mother is adequate to pass to baby through your breast milk.
Oh, I love that.
Yeah. I don't know about you, but I forgot a lot to do the vitamin D drops. Choline is another huge one. You have much higher demands postpartum, and it is so important for baby's brain development and neural development during the early stages. And there are studies now that show even up to 7 years after a child is born, they have better cognitive performance, better fine motor skills if their mother was replete in choline. And it also helps the mother drastically. Like we talked about in the beginning, there are physiological changes in your brain. And choline really reduces the mom brain, that brain fog that so many of us experience. I had trouble recalling words when I was postpartum. I had this vision of what I wanted to say, and my mouth could not spit it out. And choline is incredibly helpful for mother's mental clarity as well.
It's so incredible. I know a lot of women, they actually can start nutrient depleted going into their pregnancies. I know a lot of women with hypothyroidism and Hashimoto's, low ferritin can be a really big deal, and it's very, very common. I've worked really hard on getting my ferritin levels before my pregnancy. And while I was pregnant, my doctors didn't actually monitor my ferritin levels, but being functionally medicine trained, I decided to test them. And my ferritin got really, really low. Because of the demands of the pregnancy, your iron requirement goes up. At the same time, I was having these crazy cravings. So I was crying if I didn't eat 2 burgers a day. One day my husband was at home and I was like, I really want burgers, and I feel like you don't love me because you didn't get me burgers today. And he goes, I got you burgers yesterday. I'm like, that doesn't count. And so he had to drive at like 5 p.m. in traffic to go get me 2 burgers. And I had to have like at least 2 burgers a day. I remember one of my friends was over who was a pediatrician, and I'm like making sloppy joes, with like red sauce. And I'm like, this looks so good. And he's like, Izabella, have you had your ferritin or your iron checked? I was also having trouble sleeping at night, and I was having restless leg syndrome. I was very moody. Sure enough, my ferritin was low. When I repleted my iron, a lot of those weird pregnancy symptoms went away. So a lot of my weird cravings went away, a lot of my moodiness, the restless leg syndrome, that just like vanished right away. And I was sleeping well at night. And I think so many times women will say, oh, I'm feeling moody. You're pregnant. Oh, I'm tired. You're a new mom. And you get all of this feedback from healthcare professionals where you're almost like just expected not to thrive during pregnancy and the postpartum period.
Well, it comes back to looking at the root cause, right? And thankfully you were intelligent enough and you were in this field and you knew to test for it. So many women don't have access to that. And I think if that were available, if nutrient testing, if any type of extensive testing were available, we would be able to avoid so many of these discomforts. Many of the symptoms that you mentioned are also linked to other deficiencies that coincide with eating red meat, right? So red meat in general, animal products are so rich in so many of these nutrients that a lot of us are depleted in. And I think, there's been a big focus on plant-based eating for a long time. I've seen so many vegetarian and vegan moms start closet eating meat during pregnancy because the cravings are telling you something. There are so many other nutrients that are in meat besides just iron. And you're supporting your body with eating these whole foods that are giving you the nutrients that you need. And, you talk about iron. Magnesium is another one for restless leg and stress and muscle cramps in general. Iron and zinc is another one that helps with all of zinc and collagen have such amazing support for all of the stretching and there's tearing in birth at times, but like your structures, your body, your tendons, your skin, everything is stretching and expanding so much. And your body needs support from all these extra nutrients. Your blood supply increases by 50%. Your iron needs increase by a factor of 1.5 during pregnancy. And so to think that, that we can get away without really nurturing ourselves and nourishing ourselves with extra care is, is naive as a culture. And I think our medical system really does need to catch up.
I think so. I wish every woman had education on how to properly nourish themselves before pregnancy, during pregnancy, and in the postpartum period, because if you're so nutrient depleted, that's going to make that time period so much harder for you.
Yeah. And, I think a lot of this goes back to education. I received no education prior to getting pregnant. I mean, despite being a nutrition professional, right? I didn't feel any more prepared than the average person going into pregnancy. I knew that I wanted a high quality prenatal, but my OB, when I asked her, said anything on the shelf at Target or CVS is fine. And I was like, I know that's not the right answer. So, I think education goes a long way. There's also a lot of misinformation out there. But this preparing for pregnancy and becoming replete prior to being pregnant can make a world of difference. And, even if you are one of those people that, find out you're pregnant at 8-10 weeks, there's so much you can do to make sure that you have a healthy pregnancy without symptoms that are uncomfortable to you. So I think it goes back to just figuring out where you have reliable information you can lean on, and doing what you can to eat a whole foods based diet, and finding supplements that really are supportive and complete, so you can fill in any sort of nutrient gaps.
A lot of times women first start experiencing a lot of symptoms from chronic health conditions and autoimmune conditions and thyroid issues postpartum. I talk to a lot of women that'll say, I was doing great, I was pregnant, I gave birth, I had this wonderful child, and then all of a sudden, I've never been the same since then. And not in a good way. We all know that motherhood changes us for the better, but some women really go on to struggle with their health. And a lot of the things that I'm doing with them is I'm looking at their nutrient levels to see what's going on there. And a lot of times we're finding a lot of different nutrient depletions. Where do these all start from, and how does this all begin?
Even with prenatal vitamins supplemented, there are over 95% of women in this country are deplete in nutrients. Wow. It is so common across the board. And you look at our food, you look at our soil, and our diet today is nowhere near as nutrient dense as our diet was 30, 40 years ago. Our soil does not contain the type of nutrients that it did long ago because of our farming practices. So, if you're a mom who can shop local and buy from the farmer's market and, get organic and grass-fed food from regenerative farms, sure, that's ideal. But that's not the reality for most of us. And, a little bit of knowledge goes a long way. A little bit of supplementation goes a long way. But you also have to know what to look for. Birth control is another thing that is so common across the board, hormonal birth control. It depletes so many of these nutrients that are very essential for healthy pregnancies. Folate, all of your B vitamins, especially B6, B12, magnesium, zinc, selenium, iron, iodine, they're all impacted by hormonal birth control. And for many women who are getting pregnant in their 30s, they've been on birth control for 20 years. So it takes a long time for your body to come back to an equilibrium of nutrient status, especially if you've been actively being depleted of these nutrients.
So we're talking about how to prevent postpartum thyroid issues and that health crash postpartum. And maybe if you had a postpartum crash, what to do about that. We'll get into that. But I think if we're really wanted to get into how to really address this, we would want to start early. So let's start with some things that women can do to perhaps prepare for pregnancy, improve their egg quality, improve their chances of getting pregnant and having a good chance of having a healthy pregnancy. We know that nutrition is such an important part of this, and I love eating good food, but at the same time, we know that can be quite limiting because we may not be able to get every single nutrient that we're deficient in or that's even required for growing a baby through just diet alone, right?
Yeah. Right. Mm-hmm. Yeah. So an egg cell starts to develop into a follicle like 7 to 8 months before it actually you ovulate. And so if you are intending on becoming pregnant, it's important to start honing in your diet and your stress levels and your environmental toxins and your lifestyle practices a fair amount of time beforehand, 7 to 8 months. Really, 3 to 4 months before you ovulate that egg is when it becomes more intensely sensitive to nutrient insults or environmental toxins. So you really, at that point, really want to make sure that you have things honed in. And that includes supplementation to fill in any gaps from your diet, right? And knowing what a quality supplement looks like, so that, if you're a person that doesn't like seafood, make sure you're getting your iodine from a supplement and various other DHA, EPA, omega-3s that are going to be really important for egg health and inflammatory processes. You really want to focus on reducing all sorts of insults to your body that are causing any inflammatory processes or allowing any toxins into your environment to create the best environment possible for healthy egg implantation. And by the way, the same goes for dad, right? When you were thinking about getting pregnant, it makes a difference. You're looking at in sperm health. You want to make sure that he is also looking at, supporting his diet with antioxidants. There are specific nutrients for both mom and dad that are supportive, like L-carnitine, CoQ10. Those are really powerful methylation support, which helps with egg development and follicle development, egg maturation. In reducing any sort of oxidative processes in your body. So really focusing on the antioxidants, selenium, vitamin C, vitamin E, zinc, all of the things that are going to really make your body a happy, low inflammation environment for this egg to implant, develop properly, and lead to a healthy pregnancy.
Carnitine is one particular nutrient that is only present pretty much in red meat in adequate amounts. So back to your point about making sure that you're eating a high quality diet. So making sure that you are getting all of those important nutrients.
Yeah. And I mean, hormonal balance also plays a big role here as well in how easy it is for you to get pregnant in the first place. And for both pregnancy or pre-pregnancy and postpartum, hormone balance plays a big role. So if you're going into it in a very balanced state, it's going to create a less likelihood that you're going to have these really huge swings in the postpartum period and the longer term issues. Like for people who have previously existing thyroid conditions or autoimmune diseases, they're the ones that are most likely to have a harder time postpartum as well. And there are other ways to support them, nutritionally. Vitamin D is usually deficient in a lot of women with autoimmune disease. If you're going into pregnancy with autoimmune issues, or potential food allergies, making sure like a gluten-free diet might help, a dairy-free diet might help. So being aware of what your conditions are going into pregnancy, filling all those gaps, supporting yourself with an appropriate diet, and following that through to postpartum.
Then during pregnancy, being on a high quality prenatal. Everybody says take a high quality prenatal. What exactly does that mean? What should it have in it? And how much of what? Does it matter how much of what you get? And is it just vitamins? Is it just minerals?
Yeah. So a high quality prenatal is, like the supplement industry, an unregulated term, right? This whole industry is unregulated. So you have to be a scrutinous consumer. And for a lot of us, the education and the deep dive that is required it's not a simple thing. It's very time consuming to know how much of this do I want, what form is the best for me, and what do I need different levels at different points in my pregnancy and postpartum. So, going into this for the supplement manufacturing side of things was a big learning curve for me because, we had to look at all of the most recent research and make sure that we were providing the ideal forms and the ideal levels. And so choline is one of those nutrients we talked about. You need more during pregnancy, even more during postpartum. And it's really essential for baby's neural development. It's one of those ones that you do not want to skip out on. Many prenatals skip it altogether because it is a bulky ingredient and it's expensive. Magnesium is another one that is bulky, and oftentimes it's included in a really cheap form. So if you're looking at, you want the active, most bioavailable forms where your body's not going to have to do a ton of work to convert them into the available absorbable forms. So like magnesium and iron are also two ingredients that are either skipped or included in very low amounts, often because they cause GI upset. Depending on the form you use, if you use the ideal forms that are most absorbable, we've found you do not have GI upset. It's not a foregone conclusion. So if you know that you are already sensitive to taking multivitamins pre-pregnancy, there are a lot of moms that get a little nervous about taking their prenatal or avoid it altogether if they're getting morning sickness. So, we paid very close attention to making sure we included the most absorbable forms of iron, magnesium. We included ginger, and the same goes for all of the other nutrients. We included the bioactive forms, and we've heard from moms who have had the most sensitive stomachs that this is, one of the only supplements they've ever taken that has not upset their stomach. So it takes mindfulness and care in selecting ingredients. The B vitamins are another huge one. You have to look for the methylated form. Vitamin D is often included in very small amounts that are not really effective. It's just, you see a lot of really popular prenatals out there that have like 10 or 12 ingredients. And it's just not enough. And even those ingredients that they do include are not enough. The amounts are not high enough. You look at choline, and the recent research, right now the RDA for pregnancy is 450 milligrams and postpartum is 550. There's research out there that is showing that even upwards of 900 milligrams is effective and safe and even beneficial in those studies where they followed the moms with the 7-year-old children who had such better cognitive tests. So, one of the benefits of being a small business is that we produce in small batches and we can pivot really quickly when new research comes out. And that is what new research is showing oftentimes, is that our RDAs are set so low. They are so antiquated, and often they're not even based on pregnant women. So when new research is coming out, they're looking at increasing doses of many of these nutrients. So, it's a good thing that we can produce in small batches. And then when new research comes out that demands more, we can include more. I think a lot of the higher quality prenatals out there, the ones that I would recommend, are often 8 capsules a day. And they include a lot. And that's hard to take for many moms. We worked really hard to get the most important things that we needed into 3 capsules a day. We do not include EPA and DHA because we want that taken separately. It oxidizes, it's an oil, and you don't want it combined with vitamins and minerals because it can go rancid. So we'll come out with an EPA and DHA supplement ideal for pregnancy later down the road. But, between a high quality prenatal, an EPA and DHA supplement, and potentially a probiotic if you're having GI issues or just want to support, gut health, those are kind of the 3 key things that I would recommend.
I love
to
that.
most moms.
I personally couldn't take a lot of the iron supplements out there, and a lot of women with thyroid issues, they have constipation from iron. So this is kind of like one of those challenging things to address. And then a lot of women, like you said, when you're pregnant, like everything makes you want to throw up, right? Sometimes swallowing 8 pills is just so difficult. What form of iron have you found to be the most effective?
Mm-hmm. We use iron bisglycinate. And we also were very conscious when we were formulating, there are some other minerals like calcium that compete with iron for absorption. So we did not include calcium, not because it's not important, but the studies show that women consume from diet in the US 980 milligrams a day out of the 1,000 that are recommended. So we did not feel like it was important to add additional calcium supplement and interfere with the iron absorption.
So important to keep that in mind.
Yeah.
I know a lot of times people will say like, I take this vitamin, and I'm like, but it's combining all of these ingredients together. And as a pharmacist, it just hurts my brain looking at all of the different nutrient interactions, how they just don't play well together. You really can't do that. What about folate? So you talked about methylfolate, and why is that form important, and what's the dosage? how much of that should we be getting?
Yeah. So folate is, as we know, very important for preventing neural tube defects. It has a big role in DNA synthesis, and in the egg quality realm, folate is very important for egg development. So we need to include methylfolate because that is the active form that your body is able to absorb and use. Over 60% of our population has the genetic mutation for the MTHFR gene that does not allow them to process folic acid. And I think we've had drilled into our heads over the last few decades that we need more folic acid. You see it in every product out there, in cereals and breads, they're all fortified with folic acid. Well, 60% of us can't process folic acid, and it actually leads to more problems when your body can't process folic acid and convert it into the active form of folate. You end up getting a buildup of homocysteine and creating another inflammatory cascade in your body that is playing against all of the processes that you want to be anti-inflammatory. So, methylfolate is that ideal form that can be used and absorbed and does not need to be broken down and converted, and is available for you, and make sure that you don't end up depleted. So we have 800 we have 800 DFEs of folate in our supplement, and upwards of that is even beneficial as well.
One really important nutrient for thyroid health is selenium. And this is something that I oftentimes recommend for women in the postpartum period, or just in general if they have autoimmune thyroid issues, because it's been shown to reduce thyroid antibodies. A lot of times it helps hair loss. A lot of women will say it really helps their anxiety and just really helps to lower that inflammatory response in the thyroid gland. I've also seen studies how selenium in a prenatal vitamin can actually prevent postpartum thyroiditis.
It's a very powerful antioxidant. And I like to think of it as like this army that puts a shield up around your thyroid. It really does protect the thyroid from antibodies and helps reduce antibodies. And that's another nutrient that is often skipped in prenatal vitamins. I don't think a lot of people know what to look for in their supplements, or what is important and why, and how it can help prevent issues down the road. You think, I feel fine and I just need a little bit of support, but you don't know what's coming, right? So we would like to think of like shoring up all of your resources, selenium being a very, very powerful one that is depleted by birth control if you've been on that, and is in higher need during pregnancy and postpartum.
So prenatal should include selenium as well.
Absolutely. Absolutely.
Yeah, interestingly, new studies have come out about how birth control is a risk factor for thyroid disease. And we don't really put it all together, how all of these different medications that we're taking, our lifestyle choices, can leave us really, really depleted. Mm-hmm. Another risk factor for thyroid disease, and this is just very well intentioned, I think, from a public health standpoint, is iodine. We know that iodine deficiency can be really problematic and can lead to iodine deficiency hypothyroidism. It can lead to a lot of fertility issues. It can lead to trouble with the offspring, with them having developmental disabilities as a result of a woman being iodine deficient during pregnancy. And I think public officials, being really well-meaning, they decided to start utilizing iodine in the salt supply. Now, this has been very, very helpful for resolving iodine deficiency for some people. And so they're not getting hypothyroidism because of iodine deficiency. But on the flip side, too much of the iodine can cause autoimmune thyroiditis. And they've also found the rates of Hashimoto's and Graves' disease, those have all increased in all the countries that are adding iodine to the salt supply. And a lot of the women that I work with, they're very just nervous about iodine. And we know that it's so important for pregnancy. What is your take on that, and what are your recommendations?
Yeah. This is one that, especially if you have autoimmune going into pregnancy, I would test your levels, because the prevalence is iodine deficiency. Over 53% of women are deficient in iodine going into pregnancy. And if you look at iodine and salt you mentioned, it actually degrades over time. And depending on the humidity in your environment, the concentration of iodine can decrease. As a population in the US, at least, we have very low iodine intake. The best food sources are shellfish, seaweed. If you look at populations in Japan who consume a lot of seaweed, there are studies that show they consume 1,000 to 3,000 milligrams a day without adverse effects in pregnancy and postpartum, which is, I don't want to encourage. It's just part of their culture. They may have genetic mutations that allow their bodies to process it differently and still have this urine iodine count that comes out normal. For women here, the recommended intake is 250 micrograms a day. And a lot of women are not even hitting the adequate intake level of 150 micrograms a day. So we're seeing more deficiency than toxicity. For women with thyroid issues, I would encourage the testing, and as often as you think you need, but deficiency is by and large much more common and more worrisome in pregnancy, especially with the increased need for iodine. I would err on the side of testing where you need to. But overload of iodine has not been a very common issue during pregnancy, so much as so that it has been warned against, or we have established upper limits. I would really discourage against, if you are labeled as deficient, you do not want to include mega doses. Slowly titrate up and get tested along the way to make sure you're staying within a healthy limit.
Yeah, absolutely. Even in women that are not pregnant, that have Hashimoto's, the amounts that you'll get in a prenatal vitamin, like 200 micrograms, 250 micrograms, these are going to be safe and helpful for thyroid function, and they're not going to increase thyroid antibodies. What I don't like you said, is when people start mega dosing. So they're going into like the 1,000 plus micrograms or 2,000 micrograms. That can be problematic. And during pregnancy, that nutrient is so important and your requirement for it goes up. So you have a little bit more, I guess, leeway, as I would put it. And you want to make sure that you're not avoiding iodine during pregnancy. Although, maybe postpartum, you might not want to do like mega doses. You might not be like munching on seaweed snacks all day, every day if you have Hashimoto's. But you do want to make sure that you are getting a high quality prenatal vitamin with iodine in it.
Yes.
While you're pregnant,
absolutely,
for the health of you and your baby.
It does pass through breast milk, and it's supportive of baby's thyroid health also. So yes, just being mindful, avoiding those mega doses, making sure you're getting enough and not too much.
Yeah, thank you so much for sharing that, because I know a lot of women with Hashimoto's are very educated about like the iodine issue, and they know that could make things worse. But at the same time, they're like, well, what do I do in pregnancy? And they're worried about making their Hashimoto's worse, and they're worried about making their Hashimoto's worse, and they're also worried about their baby. And luckily, fortunately, using therapeutic doses of iodine is going to be helpful for both the mom and baby during pregnancy.
It's also one of those nutrients that's very hard to track because you don't see iodine amounts on a food label. So, having to look up, okay, how many ounces of shrimp should I eat, and how many milligrams of iodine am I getting, micrograms of iodine am I getting? It's a really tedious process. So, if you have a prenatal, that you have a baseline level, and then knowing when you're adding to that with the sources that are rich in iodine, the shellfish, the seaweed, that's a good sort of baseline structure to follow.
Yeah. And can we talk about seafood during pregnancy? I know when I was in pharmacy school, we were learning about you should only eat this much seafood while you're pregnant because of the mercury. And I remember one of my friends was sitting next to me and she's like, I'm just not going to have any seafood at all while I'm pregnant. And I feel like this is another one of those things where you want to have some, and you want to be looking at the quality and the amount. We definitely don't want to go for fish that are like high mercury fish, like eating canned tuna all day, every day. What are some guidelines for women as far as seafood goes during pregnancy?
Following the standard safety guidelines, we all know that, large predatory fish like tuna or shark are high in mercury. They consume a lot of smaller fish that also are high in mercury. So you want to look up those types of fish, avoid the types of fish that are high in mercury, avoid eating them often, because eating fish that are high in these beneficial fatty acids, the omega-3 EPA and DHA, like salmon and tuna, to some extent, are completely beneficial and healthy. You want to avoid eating, more than 3 or 4 servings a week, but excluding them from your diet completely is not advisable. You're missing out on a lot of nutrients.
Yeah. Yeah, I think that makes a lot of sense. It's like a common sense approach too.
And I think, the other side to that is, if you do not eat enough seafood, maybe you don't like it, making sure that you are supplementing with the EPA and DHA and making sure you're getting that from a very clean source, because they can be contaminated with heavy metals or PCBs and other toxins. So making sure you choose a brand that has been tested.
That's such a good point. And do you have a dosage recommendation for fish oils for omega-3s?
So with DHA, you want about 500 milligrams a day. And EPA also helps with delivery of the DHA across the placenta. And so you want to make sure that you're getting EPA paired with that. So anywhere from 100 to 400 milligrams of EPA is important too.
Yeah, thank you for that. I know when we get into the postpartum period, oftentimes people talk about, okay, just take your prenatal vitamin, right? And I was doing that, and I was going through all the sleep deprivation, and I just started doing a little bit more research. I started to take more choline than what was recommended during pregnancy, and I started to take more fish oil than was recommended during the pregnancy. And I was like, oh, that mom brain thing just kind of went away.
It's also very effective for preventing postpartum depression. You talk about all of the beautiful impacts of omega-3s, and it's it kind of affects everything in a good way. Postpartum depression, the inflammatory process, healing and recovery, the physical healing and recovery of your body in the immediate postpartum period. It's a beautiful supplement. It's a beautiful nutrient that our bodies really benefit from.
Can we get into postpartum? So a lot of times we started to talk about how women are just sort of left on their own in the postpartum period. And you have all of this, even in my own education, I was putting all this energy into learning about how to get pregnant. And then I got pregnant. It was amazing, right? And then during what you should be doing during pregnancy, and then postpartum, you're just like, here's this beautiful child, bye, right? You're kind of left on your own. But you actually created a postpartum supplement. We're looking at all of the research of what women need in the postpartum period to really thrive.
Mm-hmm. Yeah, I think, we don't know what's going to hit us until it hits us. And then you're in this phase of postpartum with a brand new baby, and you're floundering because you don't have time to invest in all of this research and making doctor's appointments and getting yourself there, or getting childcare if you don't want to bring the baby along. And oftentimes it's stuff that your body's experiencing, not necessarily the baby. So, you're putting yourself at the bottom of the totem pole as far as priorities go, which is not actually benefiting your baby or your family. We need to be taken care of. And there are a lot of nutrients that we're missing and are in desperate need of repletion postpartum, because you will never enter postpartum as replete in nutrients as you were pre-pregnancy. You are depleted and you need help. So prenatals are one of them. We created this postnatal. This was our first product that we came out with because of my experience postpartum and realizing there was nothing out there to support moms. I had 14 different supplement bottles on my nightstand postpartum based on everything that my lactation consultants and friends and everyone else was telling me would help. It was like moringa and all of these different botanicals, and trying to do anything I could to support my body and not knowing what to do. And so, number one, there's not a lot of education about how to help. And number two, I don't think we're well prepared in what to look for. You know, I never expected to have issues breastfeeding the way that I did. And I didn't even think of having a lactation consultant lined up. So it took me 3 to 4 weeks to even find a lactation consultant and get in. And by that time, you know, my breast milk supply is already established. And it took a lot of work to even get close to producing enough. But then I discovered, you know, my son had a tongue tie and lip tie and had all these complications that, had I known at the beginning, our experience could have been very different. You know, there are a lot of other physical symptoms like prolapse or tearing or any sort of like the wound healing that comes along with C-section recovery that are just not supported the way they should be. I didn't even know what a pelvic floor physical therapist was until my second baby. And, you know, it makes an enormous difference in your recovery. Yeah.
I think for anybody listening that's planning a pregnancy, some of the advice that I'd love to pass down would be looking into a pelvic floor therapist. Maybe you ask your pediatrician for recommendations of somebody that they recommend that's really great. Having a lactation consultant sort of like programmed into your speed dial, and having a really high quality one. A postpartum doula, this was a really, really big game changer for me. I know some women will have doulas at the time of their birth. This was incredibly wonderful too. And also the postpartum doula comes over to your house and helps to take care of you and the baby, teaches you how to bathe the baby, how to, you know, can cook for you, help with light housework. I used to live in the Netherlands, and every woman, the government that had a baby, the government would send a baby nurse for like 60 hours postpartum. And the nurse would come and, you know, hold the baby, give the mom a hug, like do some laundry, teach her how to do things around the house, and just help out with that transition that we go through.
Yeah. And, you know, I so wish our postpartum care was different in this country. But I would encourage and add to that, if you are able to establish sort of a group of friends or other moms that you know before you give birth, moms that you trust, who you can say, hey, I'm experiencing this, what do I do? So, you know, for example, sometimes depending on the way your baby is birthed, they may have restrictions that chiropractors can fix very easily. But if you don't know what to look for, that could mean that there's only one way you can hold them and feed them comfortably. Otherwise, they're screaming, or maybe they'll only feed on one side because that other side is very uncomfortable for them. And you just don't know this. But if you have a network of moms or practitioners that you can trust and ask questions of, that is extremely valuable. I would also say the best gift that you could ever give a mom, especially postpartum, is a home-cooked meal. And, you know, if you're a friend that has a mom that's pregnant, set up a meal train for her and make sure it's full, because, you know, at least for the first 4 weeks, because, you know, it's one less thing to think about, and having a home cooked meal is the best gift, especially, you know, if we want to talk about nutrients, you know, making sure like you're adhering to these sort of guidelines of these slow cooked meats, lots of bone broth, well-cooked vegetables, warm meals that are really nourishing and have a lot of this collagen and other glycine and proline and all these amino acids that really help heal all the connective tissues and are just nourishing for healing.
Yeah, the postpartum soups are just the best for healing. And it's interesting. I remember like freezing foods and kind of getting stuff ready. And I was craving all kinds of like burgers and kind of like hard foods during my pregnancy. But postpartum, I like didn't even want to look at that. So it's kind of interesting. And I think people just don't know these things. Like I just had no idea. And I had no idea that I was going to have like bleeding for 6 weeks postpartum. Nobody told me that. And I remember having my sister-in-law, she was coming over, do you need anything? And I was like, can you get me some extra large pads, right?
Yeah. I can't understand it. I can't understand why it feels like this information is kept in a vault and you're not allowed to know until you experience. You know, my mom never told me this stuff. I didn't hear it from anyone else in my life. And I honestly feel badly for how I showed up for my friends who had kids before I had them, because I didn't know what they needed. And I had this gift of my best friend at the time when I had both of my kids was around. She set up my meal trains. She came over and she sat with my babies and let me take showers and took my dog for a walk. And like these beautiful gifts, like of acts of service, are worth their weight in gold for a postpartum mom.
Mm-hmm. One of my friends just brought like jugs and jugs of bone broth, and I was so grateful and so happy for that. It's just incredible. One of the things that I found really helpful for nausea during pregnancy was B6. What are your thoughts about that?
Yeah, B6 is one of those nutrients that is often really depleted. And going back to nausea in general, it is very much tied to nutrient deficiencies. That's not to say that's the only cause, but many times when you fill those nutrient gaps, the symptom goes away. B6 is one of those ones that is often very depleted, birth control and from our diet in general. And in supplements, it is often in not the best form. We use P5P, which is pyridoxal 5-phosphate, the most absorbable form. It's the active form. So if you're looking at your prenatal vitamin and you see a different form, consider changing. Same with folic acid. If you see folic acid in your prenatal, throw it out. So, B6 is a big one that causes nausea during pregnancy. And honestly, it's a lot of slowdown in gastric motility. And so sometimes it helps to have those little small snacks, and sometimes it doesn't help. I've also had moms that no matter what they tried, they just experience this nausea throughout pregnancy. So it's sort of this unicorn where you can do everything you possibly can. That's, ginger is a good one. That's why we include it. Making sure that the nutrients you're taking are in their active forms and hoping that resolves things for you.
For me, I remember it was taking P5P that really helped me with the nausea, except for on days that I had to give speeches or do talks. Like no matter what I took that day, like I would just get really nauseated. So I had to take a little pause from that for a while. I was like, let's schedule this for some other time, because I remember presenting at an IFM conference, and I right before I started speaking, I had to run out of the room. And that was before I started the P5P, but I think a little bit of it can go a long way. And then too much of it can be problematic for women too, because it can potentially suppress prolactin. So oftentimes postpartum, you may not want to take more than, is it 50 milligrams?
Yes.
Is that right?
Yes. We don't add any additional in the postnatal.
Yeah. And I think those are just some of these nuances that I think I'm just so grateful that you've taken the time to research that for all of us. Can you talk about some of the ingredients that you put in your postnatal that are, maybe some extra that you wouldn't get in a prenatal, right?
We include additional vitamin A in the postnatal because it is so important for building baby's immunity and preventing infection, and also supporting mom's immunity. Vitamin A is one of those sort of Goldilocks nutrients where you want to make sure you don't get too much, especially during pregnancy. But it is very important as it passes to baby through breast milk. We add additional vitamin C for immune support as well, and boosting that antioxidant healing and giving, your body all of the power it needs to fight against any free radicals, especially with, thyroid inflammation. There's additional vitamin E and choline and vitamin D. So when you take the prenatal and postnatal together, you're getting that 6,400 IUs of vitamin D that you need to pass to baby. And for healing and recovery and immunity and mood boosting. And we also have this beautiful botanical complex that we added in there. We worked with a registered herbalist. We include shatavari, which is just a beautiful, soothing botanical that really helps with hormone balance to avoid some of the symptoms of these big roller coasters that you can get postpartum. We use lemon balm as a nervine to help with any postpartum anxiety, depression, mood ups and downs. Moringa is a galactagogue that we include. It's been used for centuries in cultures to help support breast milk production. It's also so nutrient diverse and dense. And then turmeric, we use curcumin and black pepper extract so that we can support the, again, anti-inflammatory process. Curcumin also has enormous amounts of research on it preventing and supporting mood and preventing postpartum depression. So, we just made a really beautiful complex of all of these nutrients that are in higher demand postpartum and supporting, botanically many of the symptoms that moms experience.
I love that. A lot of the vitamins are what I would give women with thyroid issues. So I think this can be a really powerful ally in postpartum health and potentially addressing some of those postpartum depletions that can lead to thyroiditis or perhaps can help women recover faster. Shatavari is actually an adaptogen, and sadly, we can't really take adaptogens during pregnancy. And I did a deep dive into which adaptogens are going to be helpful postpartum and which ones can be potentially problematic. Some of them can suppress lactation. Some of them just can make the babies, grow hair. Some of them can make the babies like really agitated. But Shatavari is one of these beautiful postpartum adaptogens that works so well. I always giggle at the meeting. It means woman of 100 husbands, yeah. Right? So it supports your calmness, libido. It supports like breast milk production. One of my girlfriends, I was having some problems with lactation postpartum, and she brought me this beautiful drink made with shatavari, and I was like, this like just kicked in my breast milk production. And then moringa, I really love. It actually helps to support iron levels in the body as well. So it's just like a very beautiful, nourishing postpartum supplement. I love that you included both of those in there. And of course, turmeric is, I feel like people know a lot about turmeric, but I wanted to highlight these other two because they're so incredible for, I feel like any woman, but also especially for the postpartum period. And they've been used for hundreds, thousands of years.
Yeah. And, but I think a lot of people will shy away from botanicals because there's not a lot of peer-reviewed evidence-based research on them. But it is a bit more anecdotal, but there is so much long-term anecdotal evidence of, not only not having poor side effects, but really having true benefits.
Yeah, I agree. So can you explain the connection between postpartum stress hormones and thyroid function?
So, there's a lot of stress happening physiologically, mentally, emotionally in the postpartum period. And is at the same time as these huge drops in progesterone and estrogen. And it creates this very stressful, imbalanced, inflamed cocktail in your body. When we have high stress, high cortisol, it's taxing on our adrenals. And all of this leads to inflammation in the body, which then is sort of slowing down and attacking and not being kind to thyroid hormone production. So it slows thyroid hormone production down. It prevents the conversion of T4 to active T3. It can increase, you can see increases in thyroid antibodies. And it's sort of this vicious cycle that, until you get this stress under control, is not going to stop. The stress also leads to higher insulin resistance, which creates more inflammation and adds to this sort of really hostile environment for our thyroid. So getting a handle on your stress management, it may seem nearly impossible at the time, but doing little things like making sure you have a little bit of a self-care practice, building in support. We talked about doulas, asking your family, asking your friends for help, taking baths, trying meditation, doing breathing exercises. I think we all have these really intense periods in postpartum where you get overwhelmed and it feels like you cannot accomplish anything. Even getting a load of laundry done feels impossible. You can't do anything from start to finish anymore. And it's what used to be stressful in your life before baby seems to pale in comparison to just, activities of daily living now. So, getting yourself out in the sunshine, going for nice slow walks, taking care of your body with massage or yoga or just very calming, soothing time to yourself is very important in stopping this stress cascade that is having all these downstream effects.
I love that. I developed a program. It was the Adrenal Transformation Program during my postpartum period because I thought I knew so much about healing the adrenals and healing the stress response. But my recommendations were like sleep for 12 hours a night, give up coffee, like decommit. And I was doing that really well when I was, not a mom. And then once I became a mom, and then using like hormones, right? So I was like, you can use DHEA and you can use pregnenolone. And then I was like postpartum and I'm waking up every 2 hours, right? So I can't really take DHEA, pregnenolone. I didn't want my baby to have like chest hair and like mustache. Like you just don't know. You don't want to risk it with taking hormones. Like I couldn't really decommit, just sleep is like deprivation is the fastest way to get into that adrenal dysfunction and stress response. And I was like, there's no way, like I never drank coffee until a few months postpartum, but there was like no way anybody was going to take my coffee from me. It just was not happening. And yeah, I mean, I was like, some moms like to go on early morning walks with their babies. I would put my baby in a stroller and drink coffee outside, like with the bright lights, just to help you kind of wake up. And I didn't realize the impact, like how much pregnancy changes your insulin response, right?
Yes, especially in the short term. It will come back into equilibrium at some point, but it is in the immediate term, 3 to 6 months. It is a very different environment.
One of my pediatrician friends recommends myo-inositol for a lot of his postpartum breastfeeding moms, and I think that can be more of a gentle way to help with hormone balancing.
Exactly. It's also very commonly recommended for people who have PCOS pre-pregnancy for the same reasons. It does help with hormonal balance and insulin resistance.
Interestingly, it's recently been studied to help with optimizing thyroid health, and it can potentially normalize TSH levels, and especially when it's combined with selenium, can get some people with Hashimoto's into remission. And I always think about what are some of these safe things that we can do that have been tested in pregnancy and postpartum and breastfeeding moms. I feel like a lot of, it was interesting. I used to get massages at this one place and then I was pregnant and they're like, we don't want to give you a massage because you're pregnant. And then I would have these healthcare professionals that I worked with and they were like, we don't work with nursing moms. And it's very, very tricky. So I really appreciate you doing so much research and sharing some of these tools and resources with us. Yeah. Practical tips for moms to balance their energy, mood, and recovery.
Yeah, I think this is a continuation of what we were talking about with managing stress, right? So finding that time to take care of yourself. And it can be very hard, but you have to prioritize it. And you prioritizing yourself is also in turn prioritizing your baby and your family, because when you're feeling better, you're going to show up better for everyone else. So whether that time to yourself is, making those phone calls to lactation consultant, booking a massage, or, acupuncture, craniosacral, there are so many amazing therapies now that can really just take care of your body and your mind and your spirit and making sure that you're coming home better than you were when you showed up, right? Energy wise, I would say less is more. A lot of us, especially in today's modern culture, are very excited to get back to working out and getting our body back to feeling strong and going back to work immediately and, kind of like forgetting that we just had a baby. And I would say the fastest way to restore your energy and your vitality postpartum is to slow down and just take it easy. Give yourself, those 6 weeks, 40 days, whatever it is, to really rest and recover, because your body will be better for it. Do the postpartum workout recommendations with somebody who is trained in postpartum bodies, who knows something about diastasis, and can help you make sure that you're entering back into an exercise world that is not exacerbating your issues. You always hear about moms not wanting to do jumping jacks later in life because they wet their pants. Well, that's not normal. And if you actually get help with it, it doesn't have to be that way. So I think just really focusing on taking care of yourself and slowing down and ignoring all of the pulls into this cultural hustle is the smartest and fastest way to regulate your mood, your energy. Yeah.
I think that's such great advice. And I know a lot of it, I don't know if I just kind of heard like, oh, you read these books and they're like your fourth trimester and it's like the first 12 weeks, but they don't talk like, and then you're just kind of expected to come right back. In the US, we don't really have maternity leave for a lot of the times. And so you're just supposed to like birth this beautiful baby and have a big life-changing event and then just go back to normal. It just doesn't work that way.
Yeah, and I think we're probably seeing a good amount of pushback against that now because, I think for so long we've been told, you can do it all, you can have it all, and it's really exhausting. It is, and our bodies are feeling it.
I wanted to ask, what inspired you to create I Am Nurtured, and how is it different than the other prenatal, postnatal supplements?
Yeah, it was my experience. It was seeing how everything out on the shelves was so poor quality. As soon as I had my son, I used a therapeutic grade prenatal, pretty well-known brand throughout my pregnancy. But when I started digging into the research, I realized even that wasn't adequate. There are maybe 3 other brands besides ours that I would actually recommend to a friend. And besides that, they all have ingredients or lack of ingredients that I wouldn't feel good recommending. So we decided to create something, do something about it, and put something out there that I think is, actually benefiting the mother and making a true difference. And it's hard to sell a feeling, right? But that's what we hear from most of our moms who use this is they feel different. They feel more energy. They feel more calm. They feel this sense of balance. They feel not nauseous. And they're able to sleep better, have more calm moods. So it's been this very rewarding passion project. It has been a huge learning curve getting into supplement manufacturing, but it feels really amazing putting a product out there that is so safe and so effective and hopefully solving a lot of these symptoms that moms are experiencing. And as far as what makes it different, well, we talked about quality and form of ingredients, and these ingredients are the highest quality out there. We test every single one of them. They are the best form based on current research. We are constantly combing through every piece of research that comes out on the topic, and the minute there's an update, our formulas are updated. And as I said, we partnered with a registered herbalist because I think botanicals are a really beautiful, often overlooked support system that, maybe gets poo-pooed by the medical system because there's not enough data on them, but they are effective, especially when you take the time to look into, what systems they're impacting and how safe they are.
I love that. Thank you so much for creating this for all of us women. We really appreciate on behalf of every woman in the world.
It has truly been a joy. Like it has been a really amazing passion project, and hearing the feedback from moms and friends of how it, especially hearing the difference between, their first pregnancy where they didn't have it and this one it's very rewarding.
I'm so excited to share it with our community. Yeah. Can you share more about the free resources you're providing to our community as well?
Yeah, we have a free PDF that we created on some very simple ways to prevent some of the most common uncomfortable symptoms of pregnancy and postpartum. So you talked about restless leg. I had that too. Magnesium and some other practices are very simple solutions for that. Nausea, insomnia, high blood pressure is another one that's very common and can lead to, early preterm birth. So it's just a wealth of information in there, and we're happy to share it.
Thank you so much for providing that to us. We're going to share it in the show notes. Where can we learn more about your work?
Our website is iamnurtured.com. We're also on Instagram and Facebook at iamnurtured. And doing podcasts like this, we're just trying to share as much information as we can about the topic, because as we talked about, the education is sorely lacking. So we have blogs on our website. We have lots of FAQs to answer many common questions. And also, we're a very small business, so if you email us, I will respond to you. Always happy to help moms out and answer any questions I can.
I so appreciate your work and the passion and the care that you put into supporting moms. And I really appreciate you taking time out of your busy day to come and see us. I would love to ask just a few rapid fire questions. What do you wish more women would know about postpartum fatigue?
That it's not normal, that for a certain period of time, yes, especially if you have a baby that doesn't sleep, that fatigue can be really crippling, but it also does not have to be as bad as we experience. I think, we talked a lot about filling the nutrient gaps. There are lots of other things that we can do to help our body heal. If you have this long-term crippling fatigue, it could be so many other issues, and getting the tests and attention that you deserve to see whether it's thyroid or some other issues going on, that's very important. So pay attention and be your own advocate.
I love that. Are hormonal imbalances after childbirth inevitable?
For a time, yes. You are going to experience the big drops in, progesterone and estrogen, as we talked about. There are fluctuations that will happen, but making sure that you are taking care of your body, and again, making sure you have all the nutrients and fuel that it needs to heal more quickly, and that it's supported and rested and has the opportunity to recover, that will shorten that window of imbalance, and you will find the equilibrium much more quickly.
I love that. Is taking any multivitamin enough for postpartum recovery?
Well, I hope that after this discussion, we know that that's a no. I will say something is better than nothing. So, if you really are experiencing terrible nausea and can't keep anything down, any type of supplement is better than nothing. We want you to have any type of support. And I know that sometimes finances can be a limiting factor for people. So that is, something to consider. You want to make sure that you can get the highest quality you possibly can, and it makes a difference.
Great. Thank you so much for joining us and for sharing your heart and your passion. I hope this conversation will help a lot of women heal from postpartum issues, maybe prevent some postpartum issues. Thank you again for being here.
Thank you for having me.